80% of adults will experience debilitating back pain at some point in their lives. 80%. That's not a statistic about sick people. That's a statistic about everyone. And here's what makes it worse. Most of them will treat the wrong thing for years before anyone figures out what's actually causing it. I've seen this hundreds of times in my practice. Patient comes in with lower back pain. They've done the MRI, they've done the physiotherapy, they've taken the anti-inflammatories. Nothing works long term. The pain comes back every single time. And almost every single time, the real cause is not in the back at all. There is one muscle that controls your entire lower back. When it stops working correctly, it sets off a chain reaction that destroys your posture, compresses your spine, and creates the kind of chronic pain that nothing seems to fix. Most doctors never test this muscle. Most physiotherapists never target it directly. And most patients spend years doing exercises that make the problem worse, not better. Today I'm going to show you exactly which muscle this is, why it stops working, what happens to your body when it does, and, most importantly, what actually fixes it. Stay until the end. The last section has the 3 exercises that I give every single patient with chronic back pain. Without them, everything else I tell you today is incomplete. To understand why your back hurts, you need to understand one fundamental thing about how your body is designed. Your spine is not supposed to be a load-bearing structure on its own. It was never designed to take the full weight of your upper body without muscular support. The muscles around it, specifically the deep stabilizing muscles, are supposed to share that load constantly with every step you take, every time you sit, every time you stand up. When those muscles work correctly, your spine is protected. The vertebrae stay in proper alignment. The discs don't get compressed unevenly. The nerves don't get pinched. Everything works as it should. But when one key muscle in this system fails, and I'll tell you exactly which one in a moment, the entire system collapses. The load shifts entirely onto the spine itself. The joints start grinding. The discs start bulging. And you feel it as pain in your lower back, sometimes radiating down into your hips, your glutes, or even down your leg. Here's what most people don't understand. The pain you feel in your back is rarely where the problem actually is. Your back is telling you it's overloaded. It's screaming for help because the muscles that are supposed to protect it have gone silent. Finding the pain and treating the pain are 2 completely different things, and almost everyone who treats back pain is treating the pain, not the problem. The muscle I'm talking about is the gluteus medius, the middle gluteal muscle. It sits on the side of your hip, running from the outer surface of your pelvis down to the top of your femur, your thigh bone. Most people have never heard of it. Most people have never trained it. And for most people over 35, it has essentially stopped working. Here's why this one muscle controls everything. The gluteus medius is the primary stabilizer of your pelvis. Every single time you take a step, it fires to keep your pelvis level. Every time you stand on one leg, it prevents your hip from dropping. Every time you go up or down stairs, it controls the alignment of your entire lower body, ankle, knee, hip, pelvis, and spine, all in one coordinated movement. When it works correctly, it's invisible. You don't think about it. Your body just moves. But when it stops working, and it stops working gradually, silently, over years of sitting, everything downstream of it starts to fail. The pelvis tilts. The lower back overcompresses. The hip flexors tighten. The piriformis goes into spasm, and you wake up one morning with back pain that seems to have come from nowhere. It didn't come from nowhere. It came from years of your gluteus medius slowly switching off, and by the time you feel the pain, the muscle has often lost 40 to 60% of its functional strength. The gluteus medius doesn't just randomly stop working. There's a very specific reason it switches off. And it's something almost everyone does for 8 or more hours every day. Sitting. When you sit, your hip is flexed at 90 degrees. In this position, the gluteus medius is completely unloaded. It doesn't need to fire. It doesn't need to stabilize anything. It just sits there, doing nothing for hours at a time. And your nervous system is extremely efficient. If a muscle isn't being used, the brain gradually reduces the neural signals it sends to that muscle. This is called neural inhibition. The muscle doesn't atrophy, it's still there, but the brain essentially forgets how to turn it on. After years of this pattern, sitting for work, sitting in the car, sitting in the evening, the gluteus medius develops what researchers call altered motor recruitment. When you stand up and start moving, your brain tries to fire the gluteus medius, but gets a weak, delayed response. So it compensates. It recruits other muscles instead, the lower back muscles, the tensor fascia latae, the piriformis. These muscles were never designed to do the gluteus medius's job. They get overloaded. They go into chronic tension. And you feel it as back pain, hip pain, and that deep aching tightness that never fully goes away, no matter how much you stretch. A 2018 study from the Journal of Orthopedic and Sports Physical Therapy found that patients with chronic lower back pain showed significantly reduced gluteus medius activation compared to pain-free controls, even during simple walking. The muscle was there, it just wasn't firing. When the gluteus medius stops working, the first thing that happens is a change in pelvic position. The pelvis starts to tilt, usually anteriorly, meaning the front drops down and the back rises up. This might sound like a small postural change, but the effect on your spine is enormous. When your pelvis tilts forward, your lumbar spine, your lower back, is forced into excessive extension. The curve increases. The posterior elements of the vertebrae start to compress against each other. The facet joints, which are the small joints at the back of each vertebra, begin to take on load they were never designed to handle. Over time, this leads to facet joint syndrome, one of the most common causes of chronic lower back pain in people over 35. At the same time, the discs at the front of the spine begin to experience uneven pressure. The L4 to L5 and L5 to S1 discs, the two most commonly herniated discs in the lower back, are particularly vulnerable. When the pelvis tilts forward, these discs are compressed asymmetrically. The gel-like nucleus inside the disc gets pushed backward toward the nerves. This is how a disc herniation begins, not from one dramatic injury, but from years of chronic asymmetric loading caused by a pelvis that isn't being stabilized correctly. Stay with me. In the next section, I'll show you exactly how to test whether your gluteus medius is the problem right now without any equipment. Stand up right now. If you're watching this sitting down, stand up. I want you to do a simple test that will tell you immediately whether your gluteus medius is the problem. Stand on your right leg. Lift your left foot about 2 inches off the ground. Now slowly bend your right knee about 20 to 30 degrees, like you're starting a small squat on one leg. Watch what happens to your right knee. If your knee tracks straight forward, directly over your second toe, your gluteus medius is doing its job. If your knee collapses inward toward your midline, even slightly, your gluteus medius is not firing properly. This inward collapse is called a valgus deviation, and it's the single most reliable indicator of gluteus medius weakness. Now try the other side. Stand on your left leg, lift your right foot, bend slowly. Same test. Many people find one side is significantly worse than the other, which is why back pain is often worse on one side. I use this test with every single patient who comes to me with back pain. In my experience, more than 80% of people with chronic lower back pain fail this test on at least one side. Not because their knee is the problem, but because the muscle controlling their hip, pelvis, and spine has gone quiet. One of my patients, 41 years old, had back pain for 6 years, saw 4 different doctors, failed this test dramatically on both sides. We fixed the gluteus medius. The back pain resolved in 8 weeks. The gluteus medius doesn't just cause lower back pain. When it stops working, it triggers a cascade of problems throughout the body that most people never connect to the same source. Hip pain. The gluteus medius is the primary muscle that holds your femur in the hip socket correctly. When it weakens, the femur starts to migrate slightly upward and inward. This creates increased pressure on the cartilage of the hip joint, and over time contributes to hip osteoarthritis. A 2020 study in the journal Osteoarthritis and Cartilage found that gluteus medius weakness was present in the majority of patients with early hip osteoarthritis, often years before significant cartilage damage appeared on imaging. knee pain. When the gluteus medius can't control the hip, the femur rotates inward. This rotation is transmitted directly down to the knee, causing the kneecap to track incorrectly, a condition called patellofemoral syndrome. This is why so many people with knee pain get better when you strengthen their hip, not their knee. Sciatica. The piriformis muscle sits deep in the gluteal region, right next to the sciatic nerve. When the gluteus medius isn't doing its job, the piriformis overworks as a compensator. It goes into chronic spasm, and in many people, this spasm compresses the sciatic nerve, causing the shooting pain, numbness, and tingling down the leg that gets diagnosed as sciatica. Treating the piriformis without fixing the gluteus medius is like treating a symptom without treating the cause. Watch to the end. What follows is the exercise protocol I give to each patient. Here's the frustrating truth about standard back pain treatment. The vast majority of it is aimed at the wrong target. Anti-inflammatory medications reduce pain temporarily, but they do nothing to fix the underlying biomechanical problem. The moment the medication wears off, the same forces are acting on your spine in the same way. The pain returns, often worse because the pain was the only signal telling you to move differently. Passive physiotherapy, heat, ultrasound, TENS machines, massage, provides temporary relief. Again, nothing changes the fundamental issue. Your gluteus medius is still not firing. Your pelvis is still tilting. Your spine is still overcompressed. Core strengthening exercises, planks, crunches, bridges are better. But here's the problem. Most standard core programs load the spine heavily without first addressing the hip stability that the gluteus medius is supposed to provide. You're building strength on top of an unstable foundation. It helps some people temporarily. It makes others worse. Stretching the lower back. This is the most common thing people do when their back hurts, and it's often the worst thing they can do. A tight lower back in someone with a weak gluteus medius is the back muscles working overtime to compensate. Stretching them out, relaxing them, removes the last compensation your body had. The pain often gets worse immediately after stretching, which tells you everything. The solution is not to treat the back. The solution is to wake up the gluteus medius and teach it to do its job again. Before you start strengthening the gluteus medius, you need to wake it up. A muscle that has been neurally inhibited for years doesn't respond to heavy loading immediately. You need to reestablish the neural connection first. Teach your brain to find the muscle again before you ask it to work hard. The best way to do this is through targeted activation exercises. These are low-load movements specifically designed to get the gluteus medius firing without involving the compensating muscles. They don't look impressive. They feel almost too easy, and they are absolutely essential. The first activation exercise is the clamshell. Lie on your side with your hips stacked, knees bent at about 45 degrees. Keeping your feet together, lift your top knee toward the ceiling, like a clamshell opening. The key is to feel this in the side of your hip, not in your lower back or your outer thigh. If you feel it in your back, you're compensating. Reduce the range of motion until you feel it only in the hip. 15 repetitions, 3 sets, each side. The second activation exercise is the side-lying hip abduction. Same starting position, but this time your top leg is straight. Lift it about 30 degrees, pause for 2 seconds, lower slowly. Again, side of the hip, not the back, not the outer thigh. 12 repetitions, 3 sets, each side. Do these every day for 2 weeks before adding any loaded exercises. This is the step that most programs skip, and it's the reason most programs fail. Once your gluteus medius is activated and you can feel it working reliably, you move to strengthening. These are the 3 exercises I use with every patient after the activation phase. Exercise 1. The single leg bridge. Lie on your back, knees bent, feet flat on the floor. Lift into a standard bridge. Then extend one leg straight, keeping your hips level. Hold for 3 seconds. The key is keeping the pelvis completely level. It must not drop on the unsupported side. If it drops, bring the leg back and reduce the hold time. This is the gluteus medius working isometrically to stabilize the pelvis under load. 3 sets of 10 repetitions each side. Exercise 2, lateral band walks. place a resistance band around your ankles. Stand with knees slightly bent, feet hip width apart. Step sideways, 15 steps in each direction, 3 sets. The band creates resistance against hip abduction, which is exactly the movement the gluteus medius controls. Watch your knees. They must not collapse inward during any step. If they do, the band is too heavy. Exercise 3. Single leg Romanian deadlift. Stand on one leg, slight bend in the knee. Hinge forward at the hip, sending the free leg back, like a pendulum. Arms reach toward the floor. Return to standing. 10 repetitions, 3 sets, each side. This is the most functional exercise of the 3. It trains the gluteus medius in the exact movement pattern your body uses during walking, running, and stair climbing. These 3 exercises, done 3 times per week, produce measurable results within 6 to 8 weeks. I want to tell you about a patient I'll call Michael, 43 years old, software engineer. He came to me after 5 years of lower back pain. He had 2 MRIs, 3 rounds of physiotherapy, cortisone injections, and had been told by one surgeon that he might need spinal fusion. When I examined him, the first thing I noticed was his posture. Significant anterior pelvic tilt. When I asked him to do the single leg squat test, his knee collapsed inward dramatically on both sides. His gluteus medius wasn't just weak. It had essentially stopped participating in movement entirely. We started with 2 weeks of activation only, clamshells and side-lying abductions every day. He called me after 10 days and said his back pain was already 30% better, just from the activation exercises. Nothing else had changed. At week 3, we added the single leg bridge and lateral band walks. By week 6, he was doing all 3 strengthening exercises. At week 8, he came in and told me he had gone hiking for the first time in 4 years without any back pain. He never needed surgery. He needed his gluteus medius to wake up. Here is the complete protocol. Weeks 1 and 2, activation only, clamshells and side-lying abductions daily. Weeks 3 and 4, add single leg bridge and lateral band walks 3 times per week. Weeks 5 through 8, add single leg Romanian deadlift. Full protocol 3 times per week, 25 to 30 minutes per session. By week 8, if you do this consistently, your lower back will feel different. Not because you treated your back, because you fixed the real problem. The gluteus medius controls your pelvis. Your pelvis controls your spine. When the muscle goes quiet, from years of sitting, from years of not using it, the entire system breaks down. And no amount of stretching, massage, or anti-inflammatory medication will fix a muscle that simply isn't firing. The path forward is straightforward. Wake the muscle up, teach it to fire again, then strengthen it progressively. Give it 8 weeks. That's all it takes for most people to feel a difference that years of conventional treatment never produced. One thing before you go. If your back pain is accompanied by numbness or tingling that runs below your knee, or if you have any loss of bladder or bowel function, see a doctor before starting any exercise program. These can be signs of nerve compression that needs to be evaluated first. If you want to understand why your knee gives out on stairs and how it connects to the same muscle we talked about today, that video is right there. Watch it next.